Hi, I'm Dr. Mark Wilkinson. I have been practicing here at this location for over 31 years now, and it just still seems like yesterday to me. Being here that long, I feel that my role is really just to set a high standard and to maintain that high standard in everything we do, from the dentistry to the relationship to the communication and even how we treat each other. I have actually been here for a long time, and friendly dentistry has actually grown up around me. It started years ago with one doctor, then I joined, and now we're up to 4 doctors. I choose to work here now because of the incredible people that I work with and the wonderful work that we do and the care that we take of our patients. All of the doctors here at Friendly Dentistry do everything we can to help those in need. Many times we referred people by different organizations who have no means to pay, and we do not turn them away. It is my job and our job, we feel, to help people that need help. We are given a license and a privilege to help people, and we do all we can. Here at this office, our doctors are trained in many different areas of dentistry, and it is our goal to provide as much service to the patients as we can without sending them off to specialists. So we do root canals, we do surgery, we do Invisalign, we do dentures, we do fillings, we do crowns. We do just about everything we can within our skill level. We still use the specialists from time to time because there are cases that do demand a specialist care. But for the most part, we keep our patients in the office as much as we can. Here at this office, we really go out of our way to treat a person. Fixing teeth is easy for dentists. That's what we were trained to do, that's what we do. But treating people is a whole different story. That's the most exciting thing about this place to me is after doing it for so long, the procedures are basically the same, but each tooth has a different body attached to it. And my interaction and my joy in dealing with that person is probably the thing that keeps me coming back, and I think it's what keeps people coming back. My role here at Friendly Dentistry is mainly dealing with the sedation patients and the high fear patients. I see patients who haven't been to the dentist in 20+ years sometimes, mainly because of fear. And the interesting thing about those people is their biggest fear sometimes is not so much the dentist and what I'm going to do. Their fear is that I'm going to look down on them or shame them or give them a lecture about where they are and why they're in that condition that they are. And we just don't do that here. We take people as who they are and what they are, and our goal is to find out what you want and work with them to give them what they want. Here at Friendly Dentistry, when we bring in something new, we make sure it's tried and true. So many times I've seen that the newest and the greatest is not necessarily the best. So we usually look about a 5-year plan of something that has proven technology and works well. We have just installed new units that actually make crowns in the office. Now I can tell you this technology has been around for at least 15+ years. And in my opinion, it seems now that the technology has gotten to the very predictable spot to where we're comfortable using it all the time. Many of my patients come to me for sedation dentistry because they are very afraid of the dentist. And some of them have not been to the dentist in 20+ years, and their needs are very great. And they're very ashamed and unhappy with their appearance. So the change in them is just dramatic. I get hugs, I get kisses, I get tears. And when you take someone who cannot smile and maybe has few or no teeth and give them a beautiful smile and a mouthful of teeth that they can chew and function with again, it's earth-shaking.